Tonight, we are going to be talking about something called prolapse. And the title of this talk is called Correcting the Bulge, because there's so many different things that can be done to help you with prolapse symptoms. So first, let's define what a prolapse is, just in case you do not know. Specifically, we're going to be talking about pelvic organ prolapse tonight. So pelvic organ prolapse occurs when the pelvic organs, which in women consist of your uterus, your rectum, and your bladder, when those organs begin to drop down into the vaginal region. So pelvic organ prolapse is something that occurs in women, and it can be very common at certain periods of our lives, with the perimenopausal and menopausal shift being one of those times, and also the postpartum period. Some women may notice some of these symptoms during pregnancy, and other times they may have heightened sensations of these symptoms in the postpartum period. So if you didn't catch those time frames, yes, hormones can be an impact, because we know that our body fluctuates when it comes to the hormonal changes that occur across the lifespan, but even across each month because of our cycles. So it is not uncommon for different times of the month for women to be more symptomatic compared to other times. Just like it's not uncommon for women as we are aging for us to experience more of these prolapse symptoms. So there are three main types of prolapse. There is a fourth, but we're going to talk about the three main types of pelvic organ prolapse. The first type is a cystocele. So that is where you have the bladder dropping down into the vaginal region. Then you also have a uterine prolapse, which is exactly as it sounds. The uterus is dropping down into the vaginal region. And then you have your rectocele, which is where you have the wall shared between the vaginal area and the rectum. You have that portion dropping down into the vaginal region. And a pterocele is a fourth type, and that involves the small intestine. But for the purposes of this, we're only going to focus on those three because those are the most common types of pelvic organ prolapse, oftentimes called POP. So with the pelvic organ prolapse, different symptoms that you may notice are things such as heaviness in the vaginal region, pressure in the vaginal region, and sometimes you can even feel or see a visible bulge. So if you're someone who notices that you're having pressure down in this area, or even if you feel something in between your legs, I encourage you to take a mirror just to see exactly if you can see something descending downward, because that can give you more information. And there are times where you may not even have symptoms at all. And then later on during the day, you're noticing your symptoms may feel worse. And this is something that can happen because gravity can impact your symptoms and also can impact your prolapse. So during the start of your day, after you've been laying down because you just woke up from the night's sleep, you may not have many symptoms. But then you may notice that you have more symptoms as the day goes on, especially if you've been on your feet more than what you typically are, or even just on your feet a lot. So being mindful that, sometimes taking breaks throughout the day so that way you can offload or even lift your hips up a little bit higher, get your knees up as well. So that way you can help offload the impact of gravity can be helpful if you're having these irritating symptoms. So with the prolapse, there are different grades. When it comes to the grading of prolapse, the most important thing that you need to know is that there are types of prolapse that remain internally, and there's some types of prolapse that actually come out externally. Now, for the ones that remain internally, you may not notice, you may not feel anything. And now with the types that come out externally, they can vary significantly to where you have a prolapse that only presents itself at certain times, compared to other times where you have a prolapse that does not seem to reduce, meaning it doesn't seem to change. You can't really get the tissues to move back inward. And that does happen. If that's the case, then you typically have more of a grade 3 or 4 prolapse. And with the grade 3 or 4 prolapse, there are times when women do benefit from surgery as the first option. But even then, Pessary should be considered, in my opinion, even with these women as well. But there are those times where, depending on the severity, depending on symptoms, where patients will decide or surgeons will decide that surgery is the best first option for these patients. Now, for other patients, a pessary may be a good option for someone who has a grade 1, 2, and like I said, 3 or 4, but definitely for grade 1 or 2. So this is where the prolapse is not really exceeding, going beyond the actual vaginal opening. And if it is, it's very minimal, and it reduces on its own, so it does go back inward. And with these grades, The prolapse itself tends to need just a little bit more support. And if the muscles aren't able to do the job, with the item I just mentioned before, a pessary, that can help provide support. So a pessary is a little internal device that you can insert in the vaginal canal to help kind of lift and hold the structures where they should be. And a pessary can be good in absence of the muscles working as well as what they should. And also when the ligaments, which are the structures that help to kind of hold everything up as well, when those ligaments aren't as strong as what they used to be. Because we do know that with time, as we age, and then also as well with certain types of pressure that's applied to the pelvic floor, the ligaments can be overpowered and they become weaker and strained over time. Because of that, yes, a pessary may help you. So don't feel like your first option has to be surgical intervention, because it doesn't. But a pessary may be something that you can consider. And the good thing with the pessary is that they're different shapes and they're different sizes. And because of different shapes and sizes, the type of prolapse that you have oftentimes is going to dictate the type of pessary that you get. So it's not one pessary fits all, but sometimes you may have to try a few different ones to figure out what works best with your lifestyle. There's some pessaries that are better managed by your provider, meaning that your provider is going to place the pessary and then leave it in place for a bit and then remove the pessary for you. There are other pessaries that you're able to manage on your own. So you're able to insert it and remove it on a daily basis. Of course, cleaning it each time before it goes back in. But pessaries are a great non-surgical option that you can use to help manage these symptoms. In addition to with the pessary, I like to tell my women, sometimes a pessary is used just for certain activities. And sometimes a pessary may be used when you full time, meaning that you pretty much leave it in for the duration of until you have to go back into your provider and taking it out. So it depends on your needs, and your needs also will dictate the type of pessary. I have some women who only use a pessary when their cycle is getting ready to start, and it has more to do with the hormonal changes. I have other women who use their pessary when they're getting ready to do higher impact-based activities such as jumping and running. And then I have some women who decide, hey, I feel much better with the pessary in place at all times. So it's good to find what works for you. So it's not always one plan fits all, just like it's not one size and one type will fit all. So with the pessary, if your pelvic floor is weak, it is a really good idea to strengthen with your pessary in place. The reason being is because now your pessary is able to help hold the organs up a bit more. So now the pelvic floor can come underneath those structures and get the better contraction to help you lift and tighten through that area. So now those muscles are able to offer you better control. Now, the goal is not to have a tight pelvic floor. The goal is to have a strong pelvic floor. And sometimes the pessary can help you to lift those structures so now you can properly contract and activate those muscles so you can work towards gaining a stronger pelvic floor. So pessary can be a great option, especially in conjunction with pelvic floor therapy, so that way you can get the muscles stronger. Now, when it comes to managing the bulge, as you try to correct it, you have to take into account what activities tend to make things worse for you. Because in the beginning, you may need to modify those activities. Now, I'm not one that likes to tell people you have to stop activities altogether unless we have a true reason or need. Because unfortunately, I believe that we can cause a lot of fear around movement. And that's not the goal. I want you to feel comfortable and confident when you're moving. So it is important that you notice and recognize how your body's feeling as you're doing different activities. And if you notice your symptoms are becoming worse after, let's say, 5 or 10 minutes, then maybe after 3 minutes, that's when you take a break. So that way we can gradually work on increasing your tolerance to that activity. And that may include exercise. That may include something as simple as, lifting a load of laundry as well. So just being mindful as to how your body is feeling while you're doing the activities. Learning how to properly move can help you in the midst of doing these activities. So if you're constantly holding your breath to try to get more stability or activate your core, then that can be problematic. As you hold your breath, you're going to generally increase the pressure in your abdominal region, and that pressure has to go somewhere. Most of the time, it's going to go downward on your pelvic floor, and that can make your symptoms of the prolapse worse. So rather than trying to hold your breath, learn to use your breath to help assist you with activities. And exhaling on exertion can be very helpful. So let's say you're someone who wants to hold their breath as they're standing up out of a chair. Instead of holding your breath, now when you go to transition, take a breath in, and then as you stand up, exhale. If your legs are weaker, we need to work on getting your legs stronger as well, because having weaker legs can also impact how your pelvic floor is responding. So if your pelvic floor is weak and your legs are weak, you're not going to get the full benefit. So strengthening the hips, strengthening your legs can be beneficial in addition to strengthening your pelvic floor. They work hand in hand. When you're also looking to do different transitional movements with activities, we already mentioned one way you can do it as far as hoping to exhale as you get ready to lift, but now also being mindful as to whether or not you're clenching your jaw, you're squeezing your butt, because when we tend to clench our jaw, squeeze our butt, we also tend to put more pressure on the pelvic floor. So a bit of body awareness is necessary. And when you're looking to correct the bulge and work on different techniques that you can do at home. So if you're someone who clenches your jaw a lot, you may want to start off with something as simple as saying, oh, before I try to do this, first, let me do a quick body check. Is my butt tightened, or am I squeezing my glutes? Is my jaw clenched? Looking at those different things so that way you can help calm those muscle groups and rely more so on your breath now to do your exhale as you exert without clenching those other areas. With correcting the bulge, constipation. If no one has talked to you about your eating habits, how much water you're getting, digestion, those different things, and you have a prolapse, they've done you a disservice, unfortunately, because constipation goes hand in hand with prolapse. And constipation can actually make your prolapse symptoms worse and cause hemorrhoids. And now we have an issue not only going on in the vaginal region, but also now at the rectal region. So with constipation, we may be wondering, how does that make a prolapse worse? How does that make symptoms more apparent? Well, it is because generally speaking, when you're constipated, you're sitting on the toilet and you're holding your breath and you're bearing down with your mic to try to get the stool and feces to evacuate. You don't have to do that. If you are doing that and you notice that your poop itself is small pellets or it looks really hard or clumpy, you're probably lacking water. So I want you to consider increasing your water intake. Now, if you're someone who says, well, I get plenty of water, I've checked my urine is at that light pale yellow color that it should be, and I'm pretty sure I'm getting plenty of water. My next question is, how much fiber are you getting? Because a lot of times we think we're getting enough fiber, but when we actually start writing down how much fiber we're intaking through our normal meals, we realize we're not getting enough. So with each meal, you want to try to aim for having 2, hopefully 3, I know it can be a stretch at times, 2 to 3 cups of fruits and vegetables with every single meal, and then getting plenty of water. Now, those 2 things are key, but also so is how you chew your food. So you want to slow down, take the time to properly chew your food, because digestion begins in the mouth. And if you're able to chew your food better, digestion can also go better, which can impact constipation. So chewing your food, increasing your water intake, and getting more fiber so you can minimize constipation and decrease the strain that you place on your pelvic floor. Those simple lifestyle changes can help you with correcting the bulge and minimizing your prolapse symptoms. Now, you may be wondering, are there any exercises that I can do to try to help with my prolapse symptoms and also help with the bulge? And the answer is yes. Yes, you can. You already heard me mention pelvic floor therapy works great alongside with pessaries if a pessary is needed. And now, if you're already symptomatic and you're noticing that you have the bulge that's occurring in that, or even the vaginal pressure that's occurring in that region, you can lay down on your back and you can lay down with your legs elevated. So now you're able to utilize gravity to help reduce your symptoms, literally and figuratively, okay? So when I say literally, I mean you're going to literally reduce the pain or sensation, the pressure that you're having. And also you're going to literally reduce the prolapse, because if you're having a grade 1 or 2 prolapse, generally speaking, that will be enough to help allow for the prolapse to start going in. So be mindful that if you're on your feet a lot and you're noticing pressure, something as simple as changing your position and offloading that area for a bit can be very helpful. Now, when you're looking to strengthen the pelvic floor, there are times where I'll have them start off strengthening in this position where they're laying down. with their knees bent, or even sometimes legs on a ball or on the wall. So that way we can utilize the impact of them not having to work against gravity. This can be beneficial as they look to try to find and discover those pelvic floor muscles, but also to help decrease the chances that they may have those symptoms as we're trying to do exercises. Because if they're noticing those symptoms as we're trying to do exercises, that can become very uncomfortable and at times discouraging. So we want to try to promote them knowing how to properly activate the pelvic floor in the beginning before we start challenging to against gravity or standing, sitting, or sitting based positions. Okay. So starting off with those positions on your back. And yes, doing a Kegel can be helpful. That's if you know how to properly do a Kegel. Unfortunately, a lot of people do not know how to properly do one. So you should not be squeezing your butt. You should not be squeezing your knees together, but you simply should be trying to, for our ladies, imagine that you have a blueberry right there at the vaginal entry. You should simply be trying to suck up that blueberry using those muscles. And another cue that I'll typically give sometimes is imagine that you're trying to zip. Literally trying to zip from your anus to the clit. And that way you can feel those muscles kind of pull up towards you. And that can be helpful when you start engaging the pelvic floor. But it doesn't stop there because pelvic floor therapy is so much more than just doing Kegels. You want to be able to turn your pelvic floor on as far as getting a good contraction, also teaching it how to fully relax as well as you're going through different activities. So you should not start and finish your entire therapy sessions as far as from like start to finish, however many weeks you may need. You should not end on your back if you started on your back. The goal is to get you to a more functional and upright position. So eventually we should start getting you doing activities that you're going to need to do on a daily basis, such as lifting. So if you have to squat down and pick up a child or pick up a laundry basket, we want to try to mimic those motions using weights. So now you learn how to properly breathe, and you also learn how to properly engage your core and pelvic floor muscles. So turning the very basic things that you learn when you're laying down, making them more functional can be very helpful when you're looking to correct the bulge. And there's another type of exercise that has gained a lot of attention over the more recent years, and that's something called hypopressives. Hypopressives are when you utilize a certain breathing technique. This is a lower intensity based upon is how much pressure is placed on the pelvic floor and on the core, where they utilize breathing techniques to gently lift the pelvic floor, engage your core muscles, and they have you holding for a prolonged period of time. The goal with these, though, is that as you become more consistent and better with them, the goal is to move from trying to solely rely on the breath hold, but now trying to use the breathing with it along with the contraction that you're receiving from the pelvic floor to combine those two things and be able to do a sustained hold somewhere between 10 to 20 seconds. So some of the basic things when it comes to breathing, where you take a deep breath in and then you exhale, gently pulling your core in, exhaling, continuing to exhale and pull your core in. You'll usually start off with trying to hold that, making your way up to 10 seconds. In the beginning, this can be very challenging for people. So with that, the goal is to make sure that you're keeping your jaw relaxed, that you're keeping your other muscles relaxed as well. So your glutes, your shoulders, and that you're solely focusing on what your abdominal muscles and pelvic floor muscles are doing. That is the very basic concept when it comes to hypopressives, because it does get much more in depth than that. But with the basic concept, you can take those same breathing techniques and transition to other movements as you become more experienced in doing hypopressives and also as your body becomes stronger. Now, my caution with hypopressives is that generally speaking, some people will want to hold their breath, and I don't want you to become lightheaded with that. So if you do not have a provider near you who is familiar with hypopressives, then before you try it, I would advise that you seek out someone who can guide you through it, okay? Because I don't want you getting lightheaded with those. Some people do tend to get lightheaded, unfortunately. But those are some different things that you can do when it comes to helping to correct the bulge. Talking about hypopressives where we ended, we talked about constipation as far as how you can manage your prolapse symptoms by decreasing constipation through increasing your water intake, increasing fiber. Exercise can help with constipation. It's also learning how to properly chew your food to help with digestion. We talked about the combination of a pessary and also pelvic floor therapy when it comes to correcting the bulge. We also talked about how when you are looking to engage the muscles, you do not necessarily have to rely on just the pessary when we talk about pelvic floor therapy as well. Now, there are a few more things, a few more tips and tricks I want to give you, in addition to some of the things we've already told you with the strengthening of the pelvic floor, the positional changes, and that's support garments. A pessary can count as a support, but it is an internal garment. There actually are external garments that you can wear, and there are different types. I'll put some links down into the description for you. That way you can check these out, because there are different types of garments that you can use that pretty much look like female jock straps, and they provide you with perineal-based support to support at just where the vaginal area is, in between the vagina, the skin there underneath, and also the rectum. They provide you with support in that area to help decrease the bulging symptoms, the pressure that you may be noticing. So that is an option as well. And these can be worn discreetly, so that way no one else knows except for you. And I've had times where women will wear these underneath their clothing and they do not need a pessary. And I've had other times women will want to combine this with their pessary as they're working on the recovery process for correcting the bulge. So taking a look at some of the different garments that are available can be very helpful, especially as you're navigating your symptoms and you're looking for relief. Now, here's the option that I did not mention yet, and that is surgery, because there are times when surgical intervention is appropriate. Now, for most women, I do not believe it should be the first go-to. I do believe that we should look at some of the other options that are available prior to surgical intervention. However, if you feel as if you've given every other option a try and lifestyle has not improved, you're not meeting where you want to be, then yes, please talk with your provider to see if you are a surgical candidate. And with this, what they're doing is they are actually helping to kind of lift and retack some of the pelvic organs that have dropped down. They are lifting those so that way now you can have better support. And with that, even with surgery, please make sure you're speaking with a pelvic floor therapist, so that way you know how to prepare for surgery and also how to recover from surgery. Unfortunately, I've seen before where individuals were not properly educated on how to prepare for surgery, and they did nothing. And because they did nothing, when it came time for them to recover, their pelvic floor was not ready to engage as far as strength. So they were not able to demonstrate a contraction. And then they were wondering, why am I still noticing some of these issues? Why do I feel like I'm having difficulty maintaining my urine? Those different things. And it's simply because the pelvic floor was weaker. So even then, it's important that with surgery that you still make sure you work with a pelvic floor therapist so we can help you recover from surgery as well. And also with the recovery piece for surgery, you want to make sure that you're not overdoing it, that you're not straining. Back to constipation, you want to make sure that you're doing the different things that you need to help minimize and decrease constipation. And also with straining, that you're not lifting too much, because you usually will have a lifting restriction in place. So that way you can allow for these structures to heal in addition to being on pelvic rest, meaning that nothing internally it is inserted for a period of time. So I hope this information has been helpful. We've talked about a lot in a very short period of time when it comes to correcting the bulge. So just remember that you have both non-surgical options and surgical options with correcting for a prolapse. We briefly described some of the different types of prolapse, ranging from a cystocele, which is when the bladder is prolapsing into the vaginal region. We had the uterine prolapse, with the uterus dropping down into the vaginal region. We had the rectocele, which is the wall between the vagina and the rectum, where you have the rectum dropping down into the vaginal region there. Those are the three main types. We did not speak on enterocele tonight, but that is the small intestine dropping down within the vaginal region. Just remember, there are different things that you can do to help correct and fix these symptoms, so you don't feel as if you have to deal with vaginal pain, vaginal pressure. Don't feel like you have to deal with a bulge or any discomfort. There are different things that we can do, both outside of surgery and yes, with surgery. Either route you take, make sure a pelvic floor therapist is involved, just to help you recover well if you decide for surgery. And if you decide surgery is not the option, to help you learn to manage your symptoms independently, meaning let us teach you what you can do, what's best for you. Sometimes, yes, it can be something as simple as minimizing constipation. Other times there is a bit more that goes into the plan, and we want to make sure that you have a good plan that is tailored directly to you. Well, if you have any questions, I'd love to hear those in the comments, but make sure you check out the description, because I'll also have down in the description information as far as that you can find the different V-slings that I mentioned, or even the perineal support that I mentioned. So that way you're able to try an external device if you want to. Pessaries, majority of pessaries require a prescription and require that you be fitted by your provider. So for pessaries, you'll have to go talk with your provider with that. And pelvic floor therapists, we can help fit you for that. So make sure that you're speaking with a gynecologist, urogynecologist, or even your pelvic floor therapist about pessary use if that's an option that you would like to try as well.